Welcome back to the OHSU Effect Inside Health and Science. I'm Lacey Evans. We're going to talk about something that all women need to know about, pelvic prolapse. Dr. Anna Denman is a urogynecologist who specializes in the medical and surgical treatment of urinary and fecal incontinence, pelvic organ prolapse, and pelvic floor dysfunction. She sees patients in the OHSU Center for Women's Health on Markham Hill. Good morning.
Good morning.
What is pelvic prolapse first, and who does it affect?
Well, really, pelvic organ prolapse is a medical condition that affects almost half of the women in the United States. It occurs when the normal supports of the vaginal wall are lost, and as a result, there's a sagging or a dropping sensation of the bladder, bowels, or uterus, or a combination.
And this usually affects women after childbirth, is that right?
That's right. About half the women in the U.S. over the age of 50 have some degree of pelvic organ prolapse, and it is associated with childbirth, though there are other criteria that could lead somebody to develop prolapse. For example, if they are a smoker, if they are overweight, if they do repetitive heavy lifting, or if they have, unfortunately, a genetic predisposition to it.
What are the symptoms? Is this something you can feel happening?
Symptoms generally are of a feeling of a bulge in the vaginal area. A lot of times the symptoms begin gradually, such as a tampon not fitting right or falling out. But then some women progress to describing a sensation as if they're sitting on a tennis ball or something similar.
Wow. So can it be painful?
It's generally not painful, but it can be fairly uncomfortable when it's advanced.
How is it diagnosed?
Generally, prolapse is diagnosed by physical examination. We basically do an examination of the pelvic area, and often we'll have the patient actually push down to see how much the bulge is coming out.
And what is the treatment of this?
There's a lot of different things that you can do for treatment. Generally, because this isn't a life-threatening condition, we try to tailor the treatment to what the patient wants. You really don't have to do anything about a prolapse that's not bothering you. Often, we'll start with something as simple as pelvic floor exercises, either by yourself or with a pelvic floor physical therapist who can help strengthen the muscles, often called the Kegel muscles, to help increase the pelvic floor muscle tone and make the prolapse less symptomatic. If that doesn't work, there's something that can be fitted into the vagina called a pessary that can help keep the bulge out of the way. And sometimes patients do opt for surgical repair, and there are many different options for surgical repair of prolapse, and we generally tailor any type of surgery to what's bothering the patient and what the patient wants.
So is prolapse something that can go away, or just the symptoms become relieved?
That's a really good question. Sometimes the prolapse can go away through pelvic floor muscle exercises, and sometimes it can simply relieve the symptoms. Surgery generally can make the prolapse go away.
Are there any consequences of a prolapse not being treated?
Really, the main consequence of the prolapse not being treated is that the symptoms get worse. And so when the symptoms get worse, the concern that we always have as providers, because this is generally affecting older patients, we worry that the symptoms will interfere with their enjoyment of daily life and their activities. So they'll stop going out, they'll stop being active, and as a result, their overall quality of life will decrease. And so that's our major concern about letting it progress.
How can prolapse be prevented?
That's a really good question. Because there are so many things that are associated with prolapse that can cause it, there aren't a lot of things that you can do to prevent it per se. The two most important things you can do are maintaining a healthy weight and not smoking, because we do know that those two things are associated with prolapse. Other things like childbirth and genetics are things that we can't really change so much.
What resources do you recommend for patients who want to learn more about this?
We have a number of resources on our OHSU Center for Women's Health website that provides some common questions people have about pelvic organ prolapse, as well as some very helpful links to national organizations that sponsor pelvic floor prolapse information websites for patients. The best one is something called the American Urogynecologic Society's patient website, which is at voicesforpdf.org, which is a fantastic resource for learning more about both pelvic organ prolapse as well as different types of incontinence.
And how can people make an appointment with you?
They can call the Center for Women's Health at 503-418-4500 and ask to be seen in the urogynecology clinic up in the Kohler Pavilion.
And all this information is going to be on our website, ohsueffect.org. Mary Anna Denman, thank you so much for joining us.
Thank you for having me.